Evening to everyone joining us today. We have a great topic today to discuss with our wonderful expert, Dr. Prati Sharma, who has been on our, IGTV, our show many times. And we're going to be talking about male infertility. So before we get started, I'll introduce myself. I'm the founder and CEO of Treehouse. We are a software company out of Ottawa that is building a software solution for allied health providers to help support the way that they care for their clients and the way that we also stay connected to our clients and to so many people across Canada is by giving informative education on topics associated to anyone from preconception to early childhood. These are topics relevant to individuals who are aspiring, expectant, or new parents. And we do that with the help and support from incredible experts like Dr. Prati Sharma. So if you'd like to see more content, feel free to follow Treehouse with that little arrow above my head, and also give Dr. Prati Sharma a like as well and follow her as well. So with that, as I mentioned, we're joined by Dr. Prati Sharma, reproductive endocrinologist and fertility specialist from Create Fertility Center in Toronto. In today's Ask an Expert IGTV, we're focusing on male infertility. What are the causes, what are the symptoms, and the treatments associated? So maybe Dr. Sharma, you could introduce yourself with respect to this topic and maybe tell us why this topic is so important for us to discuss today.
Sure. So for those of us who haven't met officially, I'm Prati Sharma. You're correct that I've been on the Grow with Treehouse platform a number of times, and I've always had a great experience. And I think you guys have really done it right in terms of educating men and women about their reproductive health. So thank you for that. I'm a fertility doctor at Create Fertility Center. And I guess the first thing I should say is happy Canadian Infertility Awareness Week. So this talk could not be more timely given we're well into Infertility Awareness Week. Lots of stuff happening, lots of informative sessions by reproductive health professionals across Canada. So let's start it. Yeah, male factor infertility, probably one of the most common situations that I see in the fertility clinic. And the reason for that is that, and we forget this, I think, because we focus on women mostly when it comes to infertility. Absolutely. It's just the natural tendency. But 20 to 25% of infertility is due to male factor. And so that is not something that's recognized enough. And so whenever a woman comes in who has a partner, a male partner, I always say, listen, this is not just your responsibility. We need to get the guy in here and test him too, because that could very well be part of this. So male factor infertility, up to 25% of infertility cases are due to male factor. And there's a lot of less interventional and more interventional treatments that are out there that can fix and help male factor infertility and also increase the odds of conception. So it's really important to get the guy in there at the same time as the woman in terms of initial testing so that we can really figure out if that's the issue and then attack it appropriately.
And so we'll go into some of those treatments as well. If you have any questions, as a reminder to everyone who's watching today, feel free to pop them in the question box below and we'll answer them live on the show today. So let's jump in and answer, what are some of the symptoms of male infertility?
Yeah, it's interesting because for men, they don't always have symptoms when it comes to having issues with their sperm. So with women, we're lucky because we have our periods. So the second your periods are off, they're irregular, you're bleeding too much or too little, you skip menses, it's an alert sign to say something's off here. Whereas for men, the truth is, and we kind of joke about this in the fertility world, men produce sperm from puberty all the way until death. So even a 90-year-old guy can produce sperm. Now, how viable is that sperm at over 50? That's another question that we can get into. But they don't really have any obvious symptoms that there could be a male factor. That being said, what are some of the things men will come in and talk about to me? One is decreased libido. I'll have men saying that their sexual desire, their desire to have intercourse is lessened, and you kind of have an idea that maybe their testosterone levels are low or something's going on. Sometimes they'll complain of decreased volume of the ejaculate, and they'll just say, it doesn't seem like a lot is coming out. And then you have a sense that maybe there is something going on with the semen analysis. There is, unfortunately, a lot of erectile dysfunction and ejaculatory dysfunction that is going around. And some of that probably relates back to anxiety surrounding the fertility process, as well as the fact that, like women, many men are on mild antidepressants or anti-anxiety agents that can potentially affect your performance. Certain cardiac medication, like blood pressure medication and things like that, can affect sperm function. Men who have diabetes will sometimes feel like their performance is not as good, and they can have something called retrograde ejaculation, where the sperm goes backwards. So there are some telltale signs. The other thing that I often see in my practice for young men and men who use things like steroids and bodybuilding agents to sort of bulk up, that's a key target sign when I think about that, because a lot of these agents contain testosterone ingredients. And that's really, it might be really great for increasing libido and bulking up body mass, but it's really, really bad for sperm. So when we talk about symptoms, it's sort of looking at their history and what they talk about in terms of their performance and their habits that can give me an idea as to whether a male factor might be present. Certainly toxic habits like smoking, excessive alcohol use, marijuana use can affect sperm quality as well. So these are the kind of things I look for when I do a history on a male, to see if I think that there will be a male factor. But the proof is in the pudding. The proof is in the semen analysis that we do, where we look at the parameters to see if the various parameters are normal or not.
And so when you have that individual within your clinic as well, how do you diagnose male fertility?
Right. So the initial test that we do on all men is the semen analysis. And so we don't generally do male hormones unless there's a clear indication or the sperm analysis comes back unusual. So in the fertility doctor's practice, the semen analysis is the gold standard first test. So that semen analysis is performed after 2 to 5 days of abstinence, just so that you don't get a low count because they just ejaculated and had intercourse. And so what we're looking at in that semen analysis is the volume of the sperm, the absolute count of the sperm, the concentration of the sperm, the motility, whether there's any bacteria in the sperm, the viscosity of the sperm, the morphology, which is the shape of the sperm. And sometimes we do a additional test called the DNA fragmentation index, which looks at the quality of the DNA and the way the DNA is packed in the sperm heads. And so that gives us a full picture of what the sperm looks like. Now, depending on what that result is, then we might order additional tests like hormonal tests, testosterone levels, FSH levels, LH, TSH, etc., or a karyotype, looking for any genetic disorder, and then we might send the male to a urologist to do further testing.
And actually, just to jump on that hormone, we have a question from one of our viewers asking, what is a normal range for testosterone when you're doing hormone testing?
So, I mean, I don't have the reference ranges fully memorized, but it's somewhere around 2 to 10. And so sometimes when you see really low levels of testosterone in the 1s and the 2s and the 3s, you worry that that's low. But we have to be really careful when we look at steroid hormone levels. And this goes for both men and women. Historically, in women, we used to measure male hormone levels all the time to diagnose polycystic ovary syndrome. But the problem is that lab tests for male hormones like testosterone and other male hormones are not very accurate. And in order to really calculate true testosterone levels, you have to look at a protein called sex hormone binding globulin. That's a protein that actually binds testosterone in the blood. And if you don't have those levels, you can't really interpret the testosterone levels on their own. So all to say, it's more complicated than just checking a testosterone level. And I'll take that one step further, because a lot of family doctors, and there's a lot of sort of male hormone specialists that are not urologists out there, that will check testosterone levels in men because they have low libido, and they'll prescribe them testosterone, either a gel or an injectable testosterone. And then they come to my clinic and they have zero sperm, because taking testosterone actually suppresses sperm production. So we have to be very careful when we look at testosterone levels, and if we treat them for just low libido in a patient who's trying to get pregnant, because you could really screw up their sperm production.
Absolutely. Great points. And if you want, again, more information or you want to consult with Dr. Sharma and her team, you can absolutely do so. And you can stay in contact with them by following them and following Treehouse. So on that note, let's talk about what a man can do to boost that fertility. If there's anything that they can eat or just part of their lifestyle changes.
Yeah. And I think the focus on, health and well-being is just so important because especially at the preconception phase, when men and women are thinking about getting pregnant in the next year or two, that's
Yeah.
really when you can work hard to maximize the activity of your eggs and sperm. So I think for men, men maintaining a healthy lifestyle, there's lots of data supporting a Mediterranean diet that's full of whole grains, fruits and vegetables, eliminating processed food, staying away from, toxins like bisphenols and BPA and phthalates as much as you can. A healthy diet, practicing good exercise and maintaining a normal body weight, those are really good things. Minimizing other toxins like smoking, any sort of illicit drugs, alcohol in moderation,
Mm-hmm.
and really minimizing things like marijuana. Marijuana has a huge effect on sperm quality. And it's interesting because it's been legalized, right? So
Yeah.
it's really sort of the new drug of choice because it's so easily accessible, especially in the younger reproductive age population, but it
Yeah.
can wreak havoc on sperm quality. And
And is that,
so it,
if I could just cut you off for 1 second, is that
do.
cannabis in all forms or really like just in a smoking form?
Yeah,
Because so many
yeah.
forms
So
now. So
you're right. You're right. And I
yeah,
guess it depends on how much you're taking and what the concentration is. I would
right.
probably say things like occasional CBD oil is probably not going to be as significant as smoking marijuana directly,
Right.
but it's all about anything in moderation. I mean, there's lots of people who say they smoke marijuana every night just to go to bed, and that probably can have an effect. Now, mind you, I see patients who say they use marijuana and their sperm analysis comes back completely normal, but I also see patients where it's very abnormal. And so we really try to eliminate anything that can affect the quality. We often
Mhm.
will see problems with DNA fragmentation, which is the way the DNA is packaged and fragmented in the sperm heads with marijuana use and toxin use. And so it is important to sort of reduce and eliminate those habits even well before you're trying to conceive, because reversing these things does take time. There's a
Mhm.
lot out there about multivitamins and how antioxidants can help sperm quality. If you
Mhm.
actually look at the true data, taking these specialized vitamins for male fertility, we prescribe something called Fertile Pro in our practice, and that is certainly a highly densely packed antioxidant for male fertility. And there's some sort of soft call data saying that it can improve sperm characteristics. So we do prescribe it. But really, truly, taking even a multivitamin a day is
Yeah.
probably enough just to keep yourself healthy and keep sperm quality healthy.
Great. Now let's turn it over to more genetic and aging issues. So, are there any genetic or aging issues that hurt male fertility? And does family history in this case play a big role?
Yeah. So let's talk about age and male fertility. So what the data shows is that, unfortunately, the women have it a little worse when it comes to aging and fertility because there's a linear decrease in egg quality as a woman ages. And we know that above the age of 37 and 40, things really dramatically change. So what we've learned is that for men, fertility also does decline with age. So it's not a perfect system, even though you've heard of the 65-year-old guy and the 23-year-old girl. Yes, that can happen. But
Yeah.
fertility does go down even in men. And we see that for men over 50, sperm characteristics like sperm concentration, motility, and just the general, quality of the sperm can decline over 50. There's also an association between advanced paternal age, so men over 40,
Mhm.
and risk of things like autism and mental illness. So again, this is not a direct correlation. The way we tell women as you get older, your risk of Down syndrome goes up exponentially because of the eggs getting older and the chromosomes not separating as well. So it's not that kind
Mhm.
of linear correlation, but there is a association with advanced paternal age and risk of these sort of soft call disorders like autism, mental health issues, and things like that. So, you know, we're not at the level where we're saying men should freeze their sperm in their 20s for use later, much like we are with women saying we should freeze their eggs. We're not quite there yet, unless they're really undergoing something toxic like chemotherapy, or they have some sort of disorder that's going to have them be on medication that's going to kill their sperm. But there is an association with age and fertility. You also mentioned family history. So that is important because certain genetic disorders can cause male factor infertility. And one of the classic ones is cystic fibrosis. And so particularly in the French Canadian population and the Ashkenazi Jewish population, these are populations that are, you know, higher prevalence for carrying the CF trait. And if you carry the CF trait, you might not even know it. And that is associated with something called CBAVD, or congenital bilateral absence of the vas deferens, which is something that causes tubes to be blocked within the testicles such that sperm isn't able to be ejaculated. And so you have to do a special procedure to extract sperm. And more importantly, if you actually carry the CF gene and your partner carries the CF gene, then that could be passed along to your baby.
Offspring.
The other thing that we always mention is that when we do a semen analysis, and let's say we find severe male factor, which is very, very low sperm counts, or something called azospermia, which is zero sperm in the ejaculate, it's very important that we do the cystic fibrosis test, as well as something called the karyotype, which is the genetic makeup of the guy, because there's chromosomal issues that the male can have that you wouldn't even know about until you do that sperm analysis. And if you use that sperm, let's say with IVF to create a baby, and you don't check out that karyotype, you could also pass along things to the baby. So I do always ask in my patients that have male factor infertility if there is a family history, because that is something that can pass along and give you some idea as to what might be the cause or the etiology of the male factor.
And speaking of some of those tests that you do, let's jump in and talk about the protocol, the common protocol that you do at your practice, but also what is common now in North America. What is the common fertility treatment protocol for a man with infertility?
So it really depends on what the diagnosis is and how severe it is. So when we do our initial testing of a semen analysis, I would say maybe the majority, 50% or so of men who have a male factor infertility will come back with slightly lower levels in one or more of the parameters. So maybe their count is borderline or a little bit low, but it's still over 5 to 10 million. Their motility, which should be at least 40% moving forward, normally is 20% or something like that. Maybe the shape of the sperm, which is the number of sperm heads that are shaped normally to fertilize the egg, maybe that's a little on the lower side. So if all else is normal, let's say your partner is a young woman with a normal workup, a normal fertility workup, then we'll say, you know, maintain a healthy lifestyle, remove toxic habits, potentially get on some vitamin supplements, and typically we'll try IUI, which is taking the sperm, washing it in a centrifuge in our lab to help improve its motility and sort of remove the bad sperm and keep the good sperm. And then we do an IUI procedure, which is taking the sperm on the day the woman is ovulating it and using a small catheter, not under sedation, and putting it past the vagina, past the cervix, high up into the uterus, close to the tube. And the goal of that is to get more viable sperm close to the egg to increase the odds of fertilization. So that's a natural first step for male factor infertility if the counts and the quality are sort of moderate to good, as a way of boosting the sperm quality and getting more to the egg. Now, mind you, if you have a 43-year-old woman who has low egg quality, even if the sperm is sort of mildly abnormal, you might move straight to IVF rather than IUI, because the female factor also plays a role. So the next level up from that, from our perspective, is IVF with ICSI, which is injection of the sperm into the egg. So intracytoplasmic sperm injection. So that's where we stimulate a woman with gonadotropin medication. Her eggs are removed after the egg retrieval. The male gives a sperm sample. And the great thing about IVF with ICSI and how we've revolutionized fertility care is that now in men who even have under 1 million sperm in the ejaculate or 0 sperm in the ejaculate, and the urologist goes in and has to access the sperm from the testicle, and we get like 5 sperm, we are actually able to fertilize in the laboratory with this technique called ICSI, where we put 1 viable sperm and inject it into the cytoplasm of the egg to allow fertilization to happen. And I mean, I've been doing this for 13 years and I'm still like wowed by this process.
Yeah.
Because like I've had guys in my career who have like 2 sperm that we find on a procedure called a microtesty, and we're able to create an embryo that eventually results in a pregnancy for the woman. So even with very severe male factor, if you find sperm
Hmm.
somewhere, you can actually
Somewhere.
create an embryo. So that's really wild. Um,
Yeah.
from the perspective of the urologist, so anytime there's a male factor, I should say, notwithstanding, and this has been data proven, that any man who has an abnormality or a significant abnormality in the semen analysis deserves a consult with a urologist. And the reason for that is that most fertility doctors, like myself, we
Yeah.
examine the woman, we do an ultrasound, we do a pelvic exam. We do not examine men typically in our practice. The male exam, testicular exam, etc., is for the specialist, the urologist. And there's a lot of data that shows that men with any sort of sperm abnormality deserve and warrant a urologic evaluation, because that urologist will do an exam and make sure there's no masses in the testicle. They look for, testicular cancer or anything that could be a problem as a blockage. So, mild abnormality is okay, but if there's anything significant, I would certainly refer to a urologist for a full exam. And
Hmm.
sometimes the urologist will also give medication like Clomid or HCG to help boost sperm counts. I'll tell you, sometimes in my practice, I'll give a little bit of Clomid to guys to help boost their sperm counts too. But beyond that, the more serious fertility medication for men is given out by the urologist. But in this day and age, most patients will proceed on with IVF pretty quickly if there's a significant male factor, rather than getting on a ton of medication.
Great, thank you. We've had some new people join us over the last several minutes, so thank you so much for
Good to
everyone
hear
who
that.
has joined. For male infertility, if you missed the first part of it, not to worry. This will be live not only on the Grow with Treehouse page, but also on Dr. Prati Sharma's, so you can absolutely listen to it as many times as you want and stay connected with us and stay connected with her. Let's continue on some questions that we have. You spoke a little bit about supplements. Are there any supplements that a male can take to increase their sperm quality?
Yeah, I mean, I think, as I said, being on a multivitamin a day is great.
Mm-hmm.
There are certain vitamins that are very good for sperm quality: zinc, selenium, coenzyme Q10, folic acid, believe it or not, vitamin E. And so if you look at that list of supplements, sometimes, lining up the pill bottles of supplements on your counter is very tricky. So for that reason, things like Fertile Pro or Pro Fertile, which is like the um, supplement that's sort of advertised and sold in one bottle, that's really good because it has everything in it in one. It's not cheap.
Mm-hmm.
It's about $100 a month, but it has been touted to improve sperm quality. So that's really great as a vitamin. As I said, maintaining a healthy diet, lifestyle, body weight, removing toxins like alcohol, any illicit drugs. Smoking cessation is very important. Smoking can really affect sperm quality, whether it's smoking marijuana or nicotine. Those are really key things to help sperm quality. And then if the sperm counts are low, considering extra agents like clomiphene citrate or Clomid, although it has some side effects which aren't so well tolerated for men. And if the sperm counts are really, really low, or in those situations where men have something called hypogonadism, classic appearance when they're on steroids and they withdraw and stop the steroids, you have to kind of jumpstart the testicles to make sperm again. The urologist will often give HCG injections and injections of FSH to get the testicles to get going again.
I see. Okay. Um, so if anyone has any questions as we're continuing to go through some of these questions, I encourage you to just pop them in your little question box below, and Dr. Sharma will respond to you directly. One of the last questions I actually have is, will having a vasectomy, we didn't talk about vasectomies
Yeah.
too much, but will having a vasectomy lead to infertility or a low sperm count?
Yes, so it's a great question. And, it's actually a common scenario I see in my practice, especially because we have to be realistic. The divorce rate is higher than we think nowadays, right? So it's quite common to see that a male was in a prior relationship, had a couple of kids, and then had a vasectomy. And, it didn't work out. They met someone else, and now they want to have children together. Totally
Yeah,
fair, right? And they
yeah,
come see me. And so the decision that we have to make is, do we do a vasectomy reversal, which is totally doable, and then
yeah.
patients can conceive naturally or with less assistance? Or we can
Mhm.
bypass all of that and move straight to IVF and do something called a PISA, where the urologists come and just stick a small needle into the tubules and get sperm out. So a lot of this depends on the full evaluation of both partners. So if I see a couple and the woman is older and has low reserve, and the male is older and it's been more than 7 years since the vasectomy was done, because the length of time between vasectomy and reversal also plays a role in terms of success rate of the reversal. We usually use the more than 7 years and less than 7 years rule. So if it's been more than 7 years, it's a little bit more tricky and viability of sperm is less. If the guy's older, the woman's older, then I definitely do counsel them to move towards IVF, because there's many other reasons to do IVF. Get pregnant quicker, don't waste time, screen the embryos, higher probability of pregnancy. But if the woman is young and her tubes are open and they feel like they want to, get pregnant in the good old fashioned way, then yes, sending to the urologist, reversing the vasectomy and trying naturally is not unreasonable. And we have a lot of successful pregnancies that happen that way. It's a pretty, the vasectomy itself is a pretty quick procedure. Vasectomy reversal is a little bit more tedious, but it's totally doable. And urologists do this all the time, and it can be very successful. So again, it depends on the whole picture. But vasectomy itself will not cause infertility, other than the fact that, yes, it does make you infertile because you can't have kids anymore. But it's not going to lead to a lower sperm count just because you did the vasectomy and then you reversed it. But again, I would say, if you've had a vasectomy and you were thinking of having kids with your partner, definitely come to the fertility clinic sooner to have your partner evaluated and look over the whole picture, because that will really influence whether a reversal route is the way to go or IVF is the way to go.
Perfect. Great. Thank you so much for that. Such a thorough response, Dr. Sharma.
Oh, you're welcome. I see a question popping up about COVID, which is actually really
talk
a
about
big
that
hot topic.
exactly.
Yeah.
Any evidence that getting COVID can lead to infertility issues? Very hot topic, very much. Thank you so much for asking that question.
So I'll stick to the male factor piece, since that's what
Yes.
we're talking about today. So there's actually a lot of data on this. And so data has shown that when a guy has active COVID, a male has active COVID, there is probably some effect of that acute inflammation, acute disease on the semen analysis. So it will not be unusual to see sperm parameters go down right at the time of active COVID, but they rebound and get better really quickly. And so, yes, okay, if you have COVID and you're trying to conceive that month, it might not work out, but you're probably not feeling too good. So it might not be the month to try to conceive anyway. And you might not want to be near your partner unless you both have COVID. But all of the data shows that having COVID itself or getting vaccinated does not have any permanent effect on fertility. You might see a slight drop in sperm parameters, just like you see maybe a month of irregular cycles, but that comes back to normal very, very quickly, both post-vaccination and post-COVID infection, without any permanent effect.
Okay, fantastic. Thank you. Another question from a viewer is asking, is IVF using IMSI recommended for severe male factor? Great question.
Yeah.
Thank you.
So ICSI versus IMSI. So, IMSI is sort of a newish technique. So basically what it is ICSI is really the standard of care when it comes to male factor infertility with IVF. And that's where they use, a specific microscope to look for normal sperm. They take the sperm using a specific needle, an ICSI needle, and they inject it at a certain point into the egg to allow fertilization to occur. IMSI uses a stronger microscope, to look a little bit more carefully at the sperm to find what we call morphologically normal sperm. So it is a technique where, yes, if there's either severe male factor or if there's a good count and a good motility, but the morphology or shape of the sperm is very, very low, like 0% or 1%, we will recommend IMSI, where they look a little bit more carefully with a special IMSI microscope to select out the normal sperm. I mean, is the data significant that IMSI versus ICSI can improve outcomes? I think maybe it could make a difference for the very, very, very bad morphology, 0% morphology cases, but I don't think it has to be used universally. I will say in our practice, because we have an IMSI scope, we do a lot of IMSI. So, perhaps there is something there.
Okay. Another question, I read them out loud because sometimes I find that when we replay, these questions are not there. So it's important for us to read them out loud to everyone. What are the statistics for pregnancy rates in couples who undergo IVF with micro TC, sperm, and embryos made with IMSI? Great question. Thank you.
Yes, and a very specific one. So,
yeah, very specific.
We can't take away the female factor from all of this. So all of this is going to be very dependent on the woman's egg quality, how many eggs she makes, and how old she is, and what her personal prognosis is. I will say that, severe male factor, micro-testy sperm, needing IMSI, that is a bit of a negative prognostic indicator. And so when you do IVF with micro-testy sperm, the recommendation, if possible, is to use fresh micro-testy sperm. So taking one step backwards, what is a micro-testy?
What is micro-testy
sperm?
Yeah,
exactly. Because I don't know if everyone in the audience
not everyone knows
what it is. Yeah. So when you have a male with severe male factor, classically, this is for a man who has 0 sperm in the ejaculate. So azospermia, that's classically due to testicular failure. So you do semen analysis, and the recommendation, just to put this out there, because I see a lot of patients where the guy comes in and has one semen analysis that shows no sperm, always repeat it, because that's a huge diagnosis to put on a patient. It's like saying you have no sperm left. So we always repeat it to make sure that you have 2 semen analysis. It sees a significant time apart to really call it azospermia. So once you have 2 semen analyses, you do hormone levels, and the hormone levels show a higher FSH and LH, which is consistent with testicular failure. Send them to a urologist, and the urologist will classically say you need a micro-testy. Now, the important thing to note, because this can be a very devastating diagnosis to couples and men, the important thing to note is that 50% of men who have azospermia, meaning no sperm in the ejaculate, will actually have sperm found on a micro-testy. So that's actually fairly reassuring to us. That, to a couple who comes and finds that their husband or their partner has, no sperm, they think, oh my God, it's donor sperm right away. But what I say is, engage the urologist, try IVF with micro-testy. I will be honest, I do tell my patients who are going through micro-testy to consider having a sperm donor as a backup, because unfortunately I've had cases where the micro-testy yields no sperm. It just happens if you're 50-50. But in any case, going back to the question, typically and classically, if it's at all possible, the recommendation is to do the micro-testy, which is where the urologist goes in the operating room of the hospital, opens up the testicle, uses a microscope in the OR to look at the seminiferous tubules. Those are the tubules that actually create the sperm. And they actually look to see where sperm is being found, and they biopsy tissue from those areas of the testicle. And so they know right then and there if they see viable sperm. In an ideal world, they would send that sperm to the IVF lab, and the woman is actually undergoing her egg retrieval that day or the next day, so that we can do a fresh fertilization, because that's where the pregnancy rates are highest. Unfortunately, with COVID and, just in general, to sort of match up the retrieval rate or the retrieval day with the micro-testy OR booking, which has to be booked like months in advance, can be kind of tricky. So we try our best to do that, but if that can't happen, then we'll freeze that micro-testy sperm and use that sperm at a later date for egg retrieval. So the benefits of that are you have the sperm available and the retrieval can be at any time. The downsides of that are that sometimes this fragile sperm will not thaw well. And so you'll thaw the tissue and there won't be any viable sperm left. So all to say that it's not easy. Successful as we are, definitely, azo and severe oligospermia with micro-testy sperm, it is definitely harder to fertilize with lower pregnancy rates. So one of the recommendations actually to do genetic testing of embryos, it's a bit of a soft call recommendation, but one of the recommendations for genetic testing of embryos is severe male factor, because we know that sperm maybe has more genetic abnormalities that could cause genetic issues in the embryos that might lead to failed implantation, miscarriage, or God forbid, an abnormality in the baby. So we do, counsel patients about PGTA, which is genetic testing of the embryos. So I would say overall, in answer to this question, the statistics probably age match women. If you took a 35-year-old woman without male factor micro-testy sperm and a 35-year-old woman with the same parameters doing IVF with microtesty sperm, yes, definitely the success rates are going to be lower when you're using microtesty sperm.
Perfect.
But I
Thank
mean,
you.
I think we have to look at the fact that we've come so far in reproductive
Of
medicine, and the
course,
fact that
absolutely.
we're not telling these men that forget it, you need a sperm donor. We can actually
Well, that's good.
try with their sperm is
Yeah.
amazing, right?
And I think over the last, half hour or so that we've been chatting, Dr. Sharma, we have just gone through so many topics that have helped our viewers and those individuals that maybe are going through this. There are options, and there are people who are skilled and specialized in this area that are there to help you and your aspiring family or your family to achieve success in this area. So
Correct.
I think with that, we'll close it up for this evening. Thank you so much for shedding light on male infertility. This is not always the most common topic. We always, like you said, tend to focus on the woman, but very important to focus on the man if your partner is a male. Are there any other kind of takeaways you'd like to leave our viewers with this evening?
Yeah, I mean, I think it's just increasing awareness, and that's really what this week
Yeah.
is about.
Yes.
And, focusing both on the female and the male. I mean, I always tell my patients, because a lot of women are coming in to freeze their eggs and they're in an early relationship. I say, listen, bring the guy in. Let's test him too,
Yeah.
because you want to know if there's any issue with him as well. And just don't focus on it as a female issue. I think men should be equally concerned about their reproductive health. I think maximizing their potential even early on when they're not trying. Come see a fertility doctor and get checked out. Really important. So I would say, just, put the pressure on the guy too. And I think it's important for men to think about their own reproductive health and well-being too.
I agree, 100%. Well, thank you so much, Dr. Prati Sharma. It was great to see you again on our Ask Me Anything and Ask an Expert series. We hope to see you again soon over the next several weeks. If you have any questions or want to get in contact with anyone at Grow with Treehouse or with Dr. Sharma, feel free to follow us, tag along, and ask as many questions as you'd like. Have a great evening, everyone, and thank you so much for joining us. Bye.
Thanks, everyone. Have a great night. Bye.